Hello guys. You know, coupling mommy duties with content creation is not easy.
At all.
Today we are we are at the playground and then with our kids, and I'm like, oh okay, let me just call Kobe to also come around and then just do this video with me. I've had a couple of people asking me about the stations for RCSI and all of that. I didn't really do RCSI, you all know. I did adaptation, and Kobe has been a coach for a very long time. He's been very helpful on my page. I believe you all know him. If you don't know him, I'm going to display the videos that I've actually done with him on my channel, okay? Yes, so in today's video, we are actually going to talk about the RCSI station. So if you are coming in as a new person and you are wondering what RCSI is it the same as what they do in the UK? You know, I have a lot of questions coming in back and forth. So today we are just going to give like an overview for the theory questions and also for the practical stations as well, and some like the main sites that you are going to have a detailed learning on, okay? And then he's also going to share some few tips with us as well. So I believe this video is actually going to be very helpful to our general nurses especially, and also to our psych nurses as well. Thank you all, and please stay tuned. So before we proceed, guys, we all know that if you want to come to Ireland and practice as a nurse, you have to register with the Nurses and Midwifery Board of Ireland. And then in the process, you are going to be issued what is called a decision letter, a refusal, or an acceptance. So for the purpose of this video, if you are being issued a decision letter, the decision letter is actually going to give you two options for you to come in and then complete an adaptation, or for you to complete your RCSI, also known as the Aptitude Test, okay? And then it's not left with you to say that I want to do RCSI, I want to do adaptation. It's actually your employer who is going to say that I want you to actually take this option, okay? So for those who are going to come in to complete the RCSI, this video is for you. And before we proceed, I just want to issue a disclaimer that this video does not replace what is on the official website, okay, the RCSI website. Kobe is just going to share his experience and also touch on a few things that we should know before we also head to the website to do a detailed learning on the website. Thank you so much for coming in, Kobe.
Thank you for having me once again on your channel. I am so grateful to be here.
Oh, that's so nice of you. Okay, so now let's go straight into today's video. When it comes to RCSI, I mean, assuming that I'm a newbie, okay, I'm a new nurse coming in from home, what should I know? Like, can you take us through the theory questions and also the practical questions? So maybe you can take the theory stations first, and then we can now look at the practical stations as well.
All right, so with the RCSI, it has two aspects.
Okay.
That is the theory,
Yeah.
and then the practical.
Yeah.
The theory, as some others say, is the computer-based test.
Yeah.
Where you sit for an objective text.
Okay.
Which you select answers based on the questions that have been asked, the right answers.
Yeah.
And then you are scored accordingly.
Okay.
That is what popularly people call CBT.
Okay.
Yeah.
So it's just like the CBT
it's
back
just
home.
like the CBT.
Yeah.
Yes.
Yeah.
And then the theory test, which is the OSCE.
Yes.
Is the same thing.
Okay.
Yeah. Diving into it with the OSCE, we have stations.
Yeah.
So with the stations, before it was, I think, 12, but now there's been restructuring and all new things have been added.
Yeah.
So I believe it is now about 14.
So it's now 14.
Yeah.
So I think in the UK it's 10 stations. Yeah. And then in Ireland it's 14 stations. I have a couple of people, before you proceed, the stations actually the same as that of the UK?
They look similar.
They look similar. Okay.
They look similar.
Okay.
Yeah.
Okay. But just it's a bit more than that of the UK.
Exactly.
Okay. Okay. So we now know that when it comes to the theory, just like CBT.
Exactly.
Yeah. Okay.
Exactly.
So now let's talk about the practical aspects. Is it just practical, or can you just go into that?
Okay. So with the OSCE, it is very practical.
Yeah.
It's very, very practical.
Okay.
You are being assessed on your competence on certain aspects of nursing.
Okay.
Basic nursing, medical nursing, and surgical nursing.
Okay. Okay.
Yes. That is what you are being assessed on.
Yeah.
So you have assessors
Okay.
representing as patients,
Okay.
or dummies representing as patients.
Okay.
Then you have all the logistics available to render nursing care, quality nursing care, safe practice nursing care to these assessors or dummies.
Okay.
Yeah.
Okay.
So that is basically how the practical goes. So with the OSCE stations, we have numerous things that we do.
Okay.
Okay. So to begin with, we have the acute station.
Okay.
Which comprises of the Klebsiella pneumonia and then DVT, which is deep vein thrombosis.
Okay.
And then neurovascular assessment. And then angina as well.
Okay.
Yeah. This station is very practical.
Okay.
You are usually assessed on how you respond to emergencies.
Okay.
Yes. And then how you use tools such as pain scale.
Okay.
Or pain assessments.
Yeah.
You know, to derive information and then how you would escalate, how you respond.
Okay.
To the patient.
Okay.
When they are in need of medical attention.
Okay.
And then the next one I'm going to talk about is a medication station.
Okay.
Medication station is in two parts.
Okay.
There is a part where you have to do the calculation aspect.
Yeah.
Where you calculate the dose of a medication that has to be administered to a patient.
Okay.
Yeah. So you need to get your calculation right and your answers right.
Okay.
And that will be checked by the assessor.
Okay.
Yeah. How you got your answer, they'll definitely look at it.
Oh, okay.
That is one part.
Yes.
Then the other part is how you would administer medication.
Itself.
Okay. And what to go about, the preparation of the medication.
Yeah.
Yes. And then taking into consideration all the rights of administering medication. The 10 rights.
Okay.
Yes.
Yeah.
So at this station, you will possibly be asked certain questions as well.
Yeah.
Because they are trying to get the competence of administering medication.
Yeah.
Yes. Knowing the right patient, the right medication, the right dosage,
yeah.
the right time, the right route, all of that.
Okay.
They look at all this. And then your knowledge about the medication you are administering.
Okay.
That's it for this medication station.
Okay. Okay.
Yeah. Then the other aspect is fundamental of nursing care. Yeah. Which comprises of assessments.
Okay.
It is also a practical station. MAST assessment tool, that is a malnutrition universal screening tool.
Okay.
Used to assess patients when they are malnourished.
Yeah.
Or just to know whether their nutritional level is okay.
Okay.
And then the other part of it is also Waterloo assessment to assess patients if they are at risk of pressure sore or pressure ulcers.
Yeah.
Yes. And then there is another aspect of fundamental of nursing, which is renal station.
Okay.
Before it was a station on its own, but now it's part of this fundamental nursing care station.
Okay.
Yes.
Okay.
Where we take urine sample from patients and then perform dipstick to determine if they have UTI, there are proteins in their urine and blood and all that. Then the escalation process will also take place. Yeah. That is basically about the fundamental nursing care.
Okay.
So, and the next station we are going to talk about is student teaching.
Okay.
So with the student teaching, it is not practical per se.
Yeah.
Yeah, because it is practical, but not really hands-on, because it is more going to be like you are going to engage someone and then teach the person. Usually like a student.
Yes.
Because as a nurse, you are a mentor as well.
Yes.
So you mentor nursing students who come into your facility to perform tasks or assignments.
Yes.
So you have to help them.
Yeah.
So that is student teaching.
Okay.
Topics that have been discussed during RCSI is stroke and MRI, H. pylori, and then gastroscopy.
Okay.
And then we have constipation, colonoscopy.
Yes.
And then other things that can be added to this constipation is Bristol stool chart and then conscious sedations.
Okay.
You mostly talk about what the condition is.
Yeah.
And everything about the condition.
Okay.
And then the investigation.
Okay.
And then the investigation, how it is being done.
Okay.
Yeah. So that's it for the student teaching. Then the next station is INU station.
Oh, yeah?
Yeah. That is also what we know back home as vital signs.
Yeah.
Yes. So you have a form that you have to chart the temperature, the heart rate, the oxygen saturation, whether the person is on room temperature, room air, or on a device, all of that. The blood pressure goes into it.
Yeah.
And then there are indicators on this chart that you would use to assess whether this person needs an attention immediately and who should be called at the point of your assessment.
Yeah.
After combining your scores and getting the one that falls within the range that you have to escalate.
Okay.
So that is basically INU's station. Then the next one is ISBAR station.
Yeah.
This is also practical. Yes, it is practical.
Yeah.
All the stations are intertwined, they are interlinked.
Yeah.
If you would notice that I keep talking about escalation.
Yeah.
ISBAR is what is used to escalate.
Yeah.
ISBAR is an acronym. The I stands for identification, the S stands for the situation, the B stands for the background, the A stands for assessment, and then the R is the response.
Yeah.
Yes. So this is a tool that is used in escalating anything to the doctor. You can't just call a doctor and tell it and then just start talking anyhow. No, it's a format, it's a process that you have to go through. And this is a tool that you use to do that escalation.
Yeah.
That's the ISBAR station.
Yeah.
And then the next I'm going to talk about also is the infection prevention and control station.
Okay.
Yeah. This is also very practical.
Yeah.
Where you have to use PPEs.
Yeah.
The correct way, the appropriate way.
Okay.
You get it. We are trying to prevent infection here. So we can't just go about doing anything anyhow.
Yeah.
Because our patients should have the best and safest care in our hands. So this station also exposes us to how to use our PPEs when we are caring for our patients.
Okay.
And then there are possibly other questions in relation to this station, that is the infection prevention, that your assessor may possibly ask you.
Okay.
You can get all this information on the RCSI website.
Yeah.
Yes, that has been provided for every candidate who is prepared to sit for these exams. You can go there and have a lot of materials there for your consumption so that you can pass these exams successfully.
Okay.
Yeah.
Okay.
The next that we are going to look at is the IV administration station. So this station is also practical, where you are being assessed on your competence on how you administer IV medication.
Great.
IV medication, IV infusion, how you spike, you prime and spike.
Okay.
Remember, I keep saying that we need to render safe nursing care to our patients.
Yeah.
So in doing this, we always ensure that we reduce infection to the lowest form.
Yes, definitely.
Reduce infection to the lowest form.
Yeah.
So this station basically will look at how you're going to administer your IV medications, IV infusions, and not contaminating the very sterile places that these medications used to flow through.
Okay.
Yes. And then how you're going to make your assessment, that is the IV sites assessment, that phlebotomy assessment, that is part of this station.
Okay.
Yeah. The next one is sepsis station.
Okay.
Yeah. It's also a form that you go through. In Ireland, sepsis is one of the conditions that is very common to get. There is a form that we use to do this assessment so that we can quickly escalate to the doctor when one has an infection. The next station is wound dressing station. This is also very practical. Yeah. Very practical. You are being assessed on how you perform your wound dressing aseptically.
Okay.
Yeah. So that's it. Then therapeutic communication and then safeguarding station. This is also a station whereby you communicate with residents, with their relatives, or patients, and then their relatives as well. And then anything regarding safeguarding is also being asked during this station. The next is patient teaching. Yeah. This is also quite practical, whereby you have a patient, a resident, or your assessor sitting right in front of you, and then you educate them on their condition. That is either being discharged or just informing them about
just like
their
we used to do back home.
Yes. Being diagnosed. Yeah. And then the next station is chest infection, whereby you are being assessed on how you administer nebules, saline nebules. Okay. That is nebulization. Yeah. And then how you administer oxygen. Okay. Safely. Safely. Yes. Yeah. The rest are new stations that have been added. That is stomach care station, and then end of life care as well. Okay. Yes. These are new stations that have been added to RCSI. You get all this information on the RCSI website. I believe that will be displayed on the screen, and then you can have access to the website. Yeah, definitely. And then go through. you would get detailed information about all these stations while you prepare for the exams.
Thank you so much, Kobe.
You're welcome. You're welcome, sister.
That's a long talk. Okay, guys. So just as he said, this is not replacing the RCSI, website. Just make sure that after watching this video, you head to the website and then go through each and every station to have a better understanding on what to do. Thank you so much, Kobe. If this video has been of great help to you, remember to like and also share. If you have any question for Kobe, just don't worry. He's actually going to reply you. Just put it under this video as well. I hope to see you all soon on my next video. Bye.